good morning, all. It's Joe Alch with Acappella. I've got two great guests today, Michelle Campoboasso and Jeanna Weaver.
Yes,
with Centric Home Health and Hospice. Great guest. And we are talking about the pandemic of loneliness. And we are still in the midst of COVID. I can't believe it's been 5 months now. We have been dealing with COVID, and I'm bringing in a great hospice and home health company, Centric Hospice. I love the medical director. He was my mentor when I was a brand new hospice nurse many years ago.
Yeah, Dr. Peralta. Yeah, he's a great guy.
He is awesome. So last week, there was an article in the news up in Danville, Colorado, I think. And it was on a senior series, An Epidemic of Loneliness. And I posted that on my Facebook page. I thought it was a really great article because seniors, we are losing our seniors. They are more isolated than ever. And to go with COVID, and there was already a problem with loneliness, and now we have even more isolation. So we're going to talk about ways to help our seniors with isolation at this time, and it can be tricky, but we are losing our seniors. And let's talk about first what's going on in senior communities. Tell me, as hospice and home health, what are you guys seeing?
In our independent livings, all the way to assisted livings, all the way to homes, what we're seeing is people that were used to a routine. Used to lunches being at a certain time, breakfast being at a certain time. You know, in the independent livings and assisted livings, now they're being brought to their door where they would go down and they would socialize. They had, they knew they took the pills after they got back from breakfast, and they did, they had that routine. And now we're seeing that's going away. We're getting calls from families. Would you please go see my mom? Somebody walked in, the pills were in a pile on the table. I mean, I've had numerous calls about that, just because, I don't know if, like me, I know right before bed I'm going to take my medicine. That's how I do it. But if my routine changes, and this is changing so much for them, and we're seeing just people not being who they were before these 5 months started, and that's sad. That's heartbreaking.
And then if their loved one, what I've found and I've seen is if somebody is sick, say they don't have COVID, but they just have a stomach bug or they just have a bad cold, are they getting that care that they need? Family can't bring up a bowl of chicken soup. They, the kitchens are very limited on what they can do, and they're just not getting that TLC. So what about families? Are you seeing, I know there's stories on the news where communities are not letting people in. There's stories that they're doing window visits, and then I saw one community is not even allowing window visits because of the social distancing of the family members. So what's your take on family involvement with seniors right now?
Well, I just think for us, I just feel like we have a great relationship with the artistry, and they're active. So they're active over 62, and they're in McKinney. And so Jeanna and I have been actually going in there, and Carol Cook is the administrator, and she's been doing a great job letting us in, doing happy hour. That has been such an amazing thing for them, and same with the chateau. So they're two different situations. One, at the artistry, they've been actually wearing their mask, and we've been doing socialization. We've been getting them entertained with doing corn dogs and doing themes, playing music, and inviting other entities in that are allowed, of course, with social distancing. But at the chateau, we've also been doing something that I actually partnered with Jeanna for a while ago that she got a great idea, is that we were doing carts. And we were getting carts of alcohol, beer, wine,
soda, chips,
yes,
Twinkies, and ding dongs, which
they love.
It brings back memories, and that's what when I had told her a long time ago, you want to stir those memories like that. Get somebody excited. That gets somebody. I don't know. When you get with your family and you talk about old times, it's just this comfort feeling, and that helps with loneliness. Reminding people of different days.
That's what I've been so big on music, and I sing in a choir too. But with my mother with dementia, and she was on hospice. The only way we could get her to take a bath was a certain song that would just get her moving, and her shoulders were moving, and we could scoot her right into the shower and get her bathed. And so music is so therapeutic. And you're right, people don't think, let's, turn on a great song that might just
Oh,
bring out
absolutely.
some-
Absolutely. Because we jam with all the oldies.
Yeah, we bring some Beach Boys down the hallways.
Yes.
And that's another thing. I suggested to a family the other day, set up a schedule. There was 3 kids. They had grandkids. Set up a call schedule. So it's not all on one person. So-and-so calls mom at breakfast to remind her you're having breakfast and take your pills and just love you. I mean, a phone call is, I know if it's not in person, but a phone call is just as much, just that connection, just that voice can really spark something in someone. And we noticed that just walking up, they would say, oh my gosh, you made my day just seeing somebody different.
Yeah.
And that's what they need. They need that little extra. And I was going to show a thing and this is something so cheap and easy that families can do, is everybody does a picture and you sign something like I would do my graduation with my grandparents, and they can also write a little note, this was my mom, and just to remind them who was there, because sometimes in the dementia stages, and somebody there can read, and it's still a brag book too. We can share that if we're in a hallway, where we can show you from a distance what is going on, and we can still see that memory. Oh, this was Gina's graduation. I remember that. And that's something you can pass around to the family, and everybody writes a little note, and they can constantly go back and read those. I mean, I know cleaning out my
love
room, I'll
that.
find old birthday cards, and you'll sit and be cleaning, and you'll end up reading every birthday card. That just stirs memories. And so that's a way everybody can have a chance to put their picture that they want, and then you can get it back and fill it more and more. And it's just, like I said, stir those memories with those loved ones, even if you can't get in to see them.
Well, and I had a cousin that got married, or cousin's son that got married a couple weeks ago in South Carolina.
Yeah.
And the grandmother was in an assisted living, and they would not let her leave to attend the wedding, which I thought was so sad, but I understood, as South Carolina, it was one of the hot spots.
Yeah.
And so what everybody did was we all took turns and saw her at the window. So she got to see everyone,
Yes.
even though she didn't get to participate and actually be at the wedding. And they also, which I thought was so sweet, they streamed it live so she could watch the actual, even though she couldn't be there. So there are creative ways to get involved with your loved one. And, everybody can have these thoughts of, I heard a speaker one time that said, with every negative thought, follow with a positive one. And so instead of saying, oh, it's so frustrating, I can't see mom. Okay, you know what? I can't go every day, but Gina, your suggestion is great. You know what? I can call on Mondays, and maybe brother can call on Tuesdays. And
And
that's-
FaceTime's really big too now. I mean, I know that some people have a hard time getting that together and pushing buttons, but we're all there. Home health, hospice, private duty, especially Acappella. You guys are out there. So even just trying to set that up for them, that means a world to them. I know my mom calls. I end up talking to her nose half the time, or the floor, but it's fine. I'm like, at least she knows that I'm there and that we're saying hi. Can you see this? I was like, no, Mom, I'm looking at the ceiling right now.
Well, it was really funny the other day. My father-in-law, he's 89, and he and his wife are homebound. And there was some kind of FaceTime. I'm not great on the computer, but we were able to get, the kids were on, and then he was on, and we just saw his forehead, but he
was there. He saw it.
Yes, he loved it so much. It was really fun. It kind of felt like the Brady Bunch. They're all looking at each other.
And then you can do, I did one for my best friend because we were in the heat of pandemic and you couldn't. And so I had people record on their phone a little short happy birthday and I mean, find a techie grandchild. Everybody has one.
Yeah.
And I just made a 3-minute video of talking. And that's something that the staff there, I'm sure, wherever they are, would be happy if they can't do it, just to show them and remind them. And it's just, I don't know. Like I said, I'm kind of cheesy when it comes to grandparents because I love mine so much. No, I just want
I
every.
know. But what about those that aren't so fortunate and those that are maybe in a Medicaid community and they don't have access to a computer? How can we, as healthcare professionals, I know you mentioned Centric. I know you all go to communities, and that is a benefit. Perhaps your nurse could schedule a FaceTime call and do it on their phone, or
Yes,
the social worker.
absolutely.
What are your thoughts on those? I know some communities have just like there's just no communication. So how can we as healthcare professionals help those?
Well, we were actually talking, and I know you have some ideas, but we were talking the other day because when we got this, we thought that there was a lot of things that we could do. So we were even talking to our social worker, and we took time, and thought, well, what if the idea that they had with the journals, what if we go to the dollar store and start buying them and dropping them off at the local skilled nursing facilities, and then we can distribute them, and they could either leave a journal and they could write their thoughts daily, and they can kind of know what they're doing, or they can do what Jeanna suggested and just kind of have some dialogue with the family and kind of pass it on that way, because you can always have, the DON have them pass it to the family. I mean, even if they can't come in, they can come to the front door, and we were just talking about, things
I
of
love
doing that.
Just notes to each other.
Yeah, and that's what I said.
Yeah.
It's simple as a book, but then they can always go back and read the ones before. Maybe it is a dementia situation, or they're in the very first of it. That's going to be a constant. Oh, okay, now it's stirring a memory. Things are, starting to happen. That's and Michelle and I were talking to Laura. They got an iCloud frame that you can be setting here and load it to your mom's room. As long as it's on Wi-Fi. And she said, and then another family was bringing in old journals of their moms. And as a nurse, you would sit down and read 5 minutes while you're there.
Yeah.
If it's there, tell our nurses, tell your nurses, tell your aides, tell anybody that you're in contact with who's seen your mother, hey, could you stop for 2 minutes? And they can do it. They will.
Yeah.
We know right now that our nurses are working harder than ever, and so are our aides and our social workers and our chaplains, but allow them to, ask them. They'll do it. If you just ask, I know, in home care and home health and hospice, they're willing to do that kind of extra stuff.
Well, and I know right now another concern is reduced staff at these communities. Kids are going back to school. People are burnt out. I mean, the staff is burned out. We're all exhausted, and we doing our very best, but what do you say to those communities that have reduced staff? How can the hospice team help with that, with your patients?
Well, palliative care, I always say everybody needs to know all about palliative care. Because that, not only are we want to come in and take care of them medically, let our chaplains come in and spend them where they can have full, PPE just like anybody else. They can come in and do that touch, that hold the hand and pray. Or our social worker that just sits and reads a minute to them or reads to them, utilize that. I always say, hospice is there. Utilize every aspect you can. Talk to your marketers that are coming in and say, hey, I need a little extra. I promise you, if they can't help you, ask the next one. There will be another marketer that'll say, let me get, so-and-so, let me get some recordings, let me get you some, tape player, or I'm saying my age, CD players, or, whatever for music. Let them help you, bring in snacks in boxes that are sealed, that, Twinkies and stuff like that. Let us help you. Ask. And if one person says no, keep asking till you find someone.
Well, we have a retired pastor that's on hospice that we're taking care of. We have care around the clock. And he loves just old instrumental hymns. And when he is feeling discouraged and frustrated that he can't see his family, we just turn on those hymns and it just, renews his spirit. Okay, so I do want to tell you guys, like I've said, Centric, y'all are amazing. I have heard, information from other hospices that they're not doing nurse visits. They're only doing telehealth. I had one the other day. It was Friday, 6:00 p.m. Patient didn't have any pain medicine. And the triage nurse said, well, this will have to wait till Monday. And
That's not
that is
happening.
just not acceptable. So what do you say to those families that are with another hospice that they are not getting what they need? And how easy is it to switch if they're not getting what they need?
First of all, it's patient choice. I always want somebody to come to my company because I believe in my company. But I always tell people, interview at least 3 companies. Sit down with them, interview them, ask them every question. You should not be rushed. This is can be one of the hardest times, but one of the most beautiful times in somebody's life is transitioning to the next side. And I personally would always want somebody, I always say you don't go to a car lot and they just give you one car, because this is even more serious than that. You want choices. Go with who you feel comfortable with. If you call and they do not send a nurse on a medical situation or send a social worker, you should have 24-hour care. Call the next day, explain your problem. If you are not happy with your answer, you discharge that hospice and you choose another hospice.
But what if they say, but I don't want to hurt their feelings. I really like the nurse aide that comes out 3 days a week. How is there a way to do it so that the family doesn't feel embarrassed or the patient doesn't feel uncomfortable?
You can talk to your doctor, the doctor that's your primary care physician or whoever maybe recommended you. If it was like a hospital recommendation, but you can always, they prefer, the family call because it has to be discharged. You can talk to your doctor's office and say, but, Miss Williams doesn't want to use your company anymore. They had some difficulties. They're going to go with another company. That's all a company has to hear.
Yeah.
So even with COVID and the problems, with getting into communities, if you have a patient, Centric has a patient on Saturday that is having a pain crisis or uncontrolled nausea, if a family member calls or the community calls and says, we really need a nurse to come out to assess, how do you respond?
You have a nurse out to assess.
Right.
That's
24/7.
That's an automatic, any kind of pain crisis is an automatic visit. If somebody calls and says, my sheets are dirty or whatever, we're going
That's
to assess
different.
the situation. Any medical pain assessment, you call us and say, hey, Dad has had a huge accident. I can't lift him. He is very dirty. We'll get somebody out there. Call. If you don't get an answer, you keep calling if it's a weekend. You insist someone comes out. So I say we have, and every hospice should have OnCall staff 24 hours a day, so they get paid to do that.
That is their full-time
that is
job.
their full-time
They have central
job.
intake
I
as
know.
well.
Yeah,
So
I mean,
the family should definitely be able to speak up. And I think that that's being just from a skilled nursing facility background. I think that they get embarrassed, like you said, or they feel like they're going to be looked at as,
They're not going to get the same care,
Right,
Because
they're not
they're
gonna-
considered, difficult,
Right. And they should not. The family always has a choice no matter what. And even if they're coming out of those hospitals and they have those programs set up for their certain hospices or home health, whatever that case is, there is enough room for everyone. And we should all be advocates. All of us should be advocates. I don't see anyone as a competitor. I see all of us working as a team. So when you sit there and tell me or take my patient that was supposed to be ours, or that you don't give us as a choice, it's not right. We have a choice. We have a voice. This company is so passionate, and I love that they're a small business, and that's why it attracted to them. And Jeanna kind of stole me.
Swayed her.
I know, yes, but we have Dr. Peralta. I've heard nothing but great things, and
I know.
with all of my referral sources, we all work together, and we all know how to share, and we all know how to care. And so for us, it's nothing but to worry about the patient and the family. And I think that's what's so great about this company as well, is that not only do they care about the patient, but they do care about the family.
Well, and I had a situation, it makes me think about, I've had Acappella for 14
Yeah.
years, but I had a friend call me who had a son that was Down syndrome. And she said, Joe, I need to, and he was young, like 17, 18. And she said, I know it's time for hospice. He had heart problems and he was in CHF. And she asked me to recommend a hospice.
Yeah.
I did because I knew the hospices that really worked with PD.
Yeah.
So fast forward a couple of weeks, her son, she called me crying. She goes, Joe, he will not stop vomiting. All they're telling me is give Benadryl. Just go to the store and get him Benadryl. I mean, you and I, we all know that is unacceptable.
Yes.
It is unacceptable.
Yes.
And so I called the hospice that Monday morning and just said, hey, want you to know I got a complaint from the mom. And, whoever the nurse is was on call really needs to address this nausea. They're going to wind up taking him to the emergency room.
Yeah.
And anyway, so I get a call a few hours later from the administrator that I have violated HIPAA and basically I need to stay in the friend zone and basically butt out. And it really angered me so much because I wasn't violating any HIPAA. I just was relaying a message, guys,
Yeah.
So anyway, you just have to be an advocate,
And I always tell people, like, we can't fix something if we don't know. And I'll be very honest with somebody. And I was the other day, it was a hospice patient. I felt like the best care they could get was in facility, setting. And they wanted to keep home. They wanted to keep him home. They want to keep him home. And I finally had to say, you are going to, you're going to lose yourself emotionally and physically trying to care for your father, and it's not going to work. So, and this facility that they wanted to send only took the hospice that was in-house. That's fine. I would rather this person get the best care and be on with another hospice than me try to put Band-Aids on stuff we could not do. And so, just like you, be the squeaky wheel. I told that to one of my best friends the other day. Her dad is a recent cancer diagnosis. Be the squeaky wheel. You have to. And it's not because people don't want to take care of you. People are overwhelmed in the medical field right now. Be the squeaky wheel. Do a checklist. On hospice, when they come out and they tell you what they're going to do for you, write that down. And if they're not doing one of those, that's on a checklist. They told you they would do that. They said they would have somebody out there 24 hours a day, to check on you. That's a red flag.
Well, and I know, right now, one concern, people are afraid of moving to a community. They want to stay at home.
Yeah.
They want to have private care. They want to do hospice at home. But I know, Michelle, you can address this. What if they need some changes to their home to be safe? Sometimes, they have steps. They've got, just
Bath
whatever.
rails,
Yeah,
yes.
bath rails. So talk about that. How easily and quickly can things take place to allow them to be safe, be at home safely?
Well, yeah, super easy. So I actually have my parents that are moving down here, and we own a remodeling company. New Look Remodeling. I'm like, just kidding. And so I have to worry about my family. And so my sister owns a guest house, and my parents, we've been talking about this forever. Finally, 20 years later, they're coming down. And so my dad's, saying, these are all the things that we want to get done. And it's easy. You just need to call a professional. I mean, just like when you're getting your referrals in home health, definitely in home remodeling, you definitely need to call, 3 referrals. Right now, everyone's, jacking up prices and having huge bids. So there's a lot of ugliness going on. So you really need to work with someone that you could trust. You need to work with someone that you know or that someone knows. So for someone like my husband, I mean, he's proficient in everything. He's going and digging out the entire bath. He's putting in, the special bathtub with the, and the special shower and the special handrails, and we're getting rid of all the rugs, and all of that stuff is super easy. And you can also go on websites and look at what specific things that you want. Home Depot, Lowe's, all of those are great referral sources. So I would definitely call a handyman and just see how fast he can get in there. I mean, in this industry as well, we're pretty overwhelmed too, but I'm really trying to focus my personal business with senior care, and that's why I'm kind of partnering with up with everyone. So if there's anything that anyone would need, I'm definitely there to give free estimates. But
That's awesome.
Definitely.
That's awesome. And
Yeah.
then let's talk real quickly. Where our time is almost up, and
Yes.
y'all are just awesome. I know people are afraid to leave the house, and I gave you an example, Jeanna. I went to a store. I was buying a birthday gift, and the store had reduced hours. They were 11 to 4. I went right after work.
Yeah.
And so a lot of seniors are getting out. Maybe they want to go to their hairdresser, and the hairdresser is only available on Wednesdays and Thursdays, or so they have to alternate their schedule a little bit.
Yes.
So just going to the grocery even is a little more challenging.
Yes, exactly.
So as far as your hospice patients are patients too, how are you guys advocates for seniors, say they need a grocery run and their kids are out of state?
Well, I mean, that's where our volunteers always come in. Let us know. I mean, I laughed the other day because our company goes up into Oklahoma, which is a lot of rural areas, and our nurse left and stopped at a grocery store, and it wasn't on her, but she said, I couldn't leave somebody that couldn't, ask if the family can call the company and say, do you have somebody that can do this? Do you have a home care Acappella? Is there somebody that asks those questions? If you're a member of a church and you can't get out, call your church. People are, I said this is such a horrible thing to happen, but it's a great opportunity to see what people need to really slow down for a minute and where you can help. But call those churches, call your hospice and home health, call your home care companies. If I can't say this enough, call home care companies also. If mom is healthy but needs that extra stuff or needs somebody to come in and check on her, make sure she has groceries. Home care companies, Acappella is great about doing that kind of stuff. That can be a weekly schedule. I mean, that's
and you can just have somebody once a week.
Yeah.
If the volunteer can't do hands-on,
Absolutely. Yeah.
and you just need a caregiver once a week to go grocery shopping and to the hairdresser the day, and just work out that schedule so we can
Absolutely.
get everything done.
And it's a huge resource for out-of-state kids, and that's what we try to say. That's something we can't drive mom to get her hair done, but let us refer this company, and that takes some, and that gives some conversation going on in the car. That gets them that loneliness taken off of them a little bit. They
Gets them
get
engaged.
excited. You know how it is. If they have a hair appointment, better be there on time.
I know. Early.
I'm the same way.
Me too. Okay, and then last thing, adult children, they a lot of the time are the decision maker for which hospice, which home health, which private duty. And right now, our adult children are juggling a lot,
Yes.
homeschooling their kids. Some districts are still online. They've got their aging parents. They've got their homework they've got to help their kids with. And then they've got their job, and my grandmother lived with me. She was supposed to live for 2 weeks on hospice. She lived for 11 months. And I had a full-time job, and I had teenagers at home. And I'll tell you, I don't know how much further I could have been stretched. It was a very difficult 11 months for me, because I wanted the best for her, But what do you say to these adult children that are juggling so much? Just how Centric, and just if their parents are on hospice, how can you help? I mean, how, just sum it up with a big bow.
Well, just the other day, we had a call on a hospice patient, dementia. The husband slipped quickly. Like I said, not in his routine. And call those as at 41, you're not ready to make those decisions. Call people. Call other people in your area that have used used companies, but also when they're on hospice, that is a full care. A social worker is coming in, is reporting back to you, a chaplain, and they don't have, if everybody has a different religion, they don't even have to talk about God. They can come in and play guitar. They can come in and just talk, pray, whatever you need. They are, like I said, a 24-hour call for your mom and dad's sitting here and he's passing away and they need that. Do that. That is something that I think is not used enough, hospice. If they're in their end of life, that is something where they need that dignity and that care, and that's what we should be giving to them. So, and then in home health, is mom's not steady? Is she not getting around? We can get therapy out there. Let's get therapy out there and get that peace of mind for you that while you're teaching kids, you can have a physical therapist there getting them strong, or they have a wound and you don't really know a lot about changing bandages and stuff, and the kids are everywhere, and you want to let us come in, let somebody come in and do that for you. Take that off your plate. You know, I always say Medicare, they work their entire life, Medicare pays for
That
it.
is
Let's
so
use it.
true.
You know,
Yes.
use it. And then if it's not something, like I said earlier, if it's not something that's medical, get a hold of Acappella, get a hold of a home care company that can say, let us go do that. Let us take that off your plate. I know mom's living with you right now and you're teaching school. We'll take her to the hairdresser. That's off your plate. Utilize your resources. I always say Google. Get on
Well,
Google.
and what I love that you said is call. If
Yes.
you have a question, it's okay to call. And too bad, they are on call. Medicare is paying a
Yes.
daily rate.
Yes.
So don't feel afraid to ask a
Yes.
question.
Stand
you
up.
know,
Stand
yes,
up for the
stand
rights
up.
of your loved ones.
That's right.
Be that advocate, because if you're not, no one's going to, because they're going to be too scared to do that. And there's just things that I even knew with my mom. I mean, I'm dealing with that, you know, and I'll have to ask Jeanna things, or I'll ask, you know, my girlfriends that are in healthcare, and I'll just say, is this right? This
I
is supposed to be
know,
right.
yeah.
Or when COVID first broke out, the procedures that they were doing, there was a home care company that, you know, technically exposed my parents. I mean, everything came out okay, but I was in healthcare and I knew, and I let them know who I was, and I let them know that what you did was not right. And I said, you're not welcome back in their home. Of course, my dad's Sicilian, so he got mad. But I made that decision. I'm like, not today, you don't. So, but you have to be that voice because they won't. They don't know. And you need to have, there's great opportunities right now, real quick, with just all the, like with you have great resources. Even just watching a podcast or just looking up these home care companies and looking to see, you know, what they've done and the things that they're doing, and just get a gist of 3 companies, like Jeanna said, of what you think that you want, because not everyone's going to be a fit. And that's why I don't look at anyone as being a competitor, because we might not be, you know, they might not like something that we do, or we might not have something, but that's okay, because we're going to give them to someone who does, and they might not get along with us, or, you know, whatever the case is, they might get along with someone else. So we'll be able to use those resources and help them, because everyone's fit for someone.
I agree. Y'all have been awesome. Amazing guests. I've got to have you back. You were
thank
great.
you.
Thank you so much.
Thank you.
So if
Thank
they
you.
want to
Yes,
get
sure.
in touch with you guys, Centric Home Health and Hospice, what's a number they can call?
They can always just call me or Michelle. Mine's 469-400-5321. Even if you're calling to ask about an assisted living, or if it's not home care, hospice, we can help direct you to what you need, or somebody that can be a concierge to take care of what you need. Then you want to.
Oh, and my number is 469-688-4024.
And Michelle, you're so respected in the community, and I know you whispered the name of your remodeling company. What's the name of it? So if somebody does have,
Thank you.
that's me. That's on me. So what if
you.
somebody does have some minor things? Just they need ramps, or just some minor repairs. What's the name of the company and who they can contact?
It's New Look Remodeling, and my husband's name is Sam. His phone number is 469-688-3498, and our website is www.nlremodeling.com. And
Awesome.
we've been in business for 20 years.
Yay! That's awesome. Thank you so much.
Thank you.
Have
Thank
a
you
great
so much.
day. We
Thank
have
you.
a pajama drive coming up for
Yes,
Grandparents' Day.
we're so excited about that.
Centric is involved. Teresa's house.
Yes.
It's going to be loads of fun on September 10th, so we will talk
Yes.
about that some more.
Yes.
If you want to give to low-income seniors with a pair of new pajamas, please contact us, And we'll have bins available. And so we're just here for our seniors. So thank you so much and have a great day.
Thank you.